They have to look for a good location. They barely can find a good area to attach a bypass graft because the disease is diffuse. The whole artery is just full of cholesterol. So that's something very, very common amongst South Asians. So when we hear the term heart attack, what does that mean? Heart attack. So it means basically that the heart no longer is getting blood. Either it could be over a time period or acutely. So we all have parents. We've all heard, okay, my father was 65, he was doing okay, went to a doctor for a checkup, he was feeling something, they did a stress test, they did an angiogram, he's got multiple blockages, he needs bypass surgery. But he was fine until a year ago. What happened? So one of the ways the artery gets blocked up is to cholesterol buildup. And that's a chronic thing. It takes 50 to 60 years of life to have cholesterol build up, where it comes to a point where it causes symptoms. So the 5th to 6th decade of life is where you develop symptoms, which are basically chest pain, shortness of breath. So that's something that you can prevent by having a healthier lifestyle. That's a chronic thing that's happening over years and years. So that's one form of heart attack, when the blockages get really bad and you get pain. So that's more over time period. The other scenario we've all heard, we've all seen, unfortunately, young person, late 30s, early 40s, just collapses, sudden cardiac death. That's from a blood clot. So 2 ways you stop blood flow is a cholesterol buildup or a blood clot. The blood clot is an acute event. It happens just like that. You have a very relatively normal artery, maybe a small plaque, 5-10% plaque that bursts, and you get a blood clot. Blood clot is a scab. So just like we get a cut on the outside of the skin and we get a scab, this is inside the artery. And it basically kind of obstructs blood flow acutely. So you get a big tear in the artery, and I'll go over what happens, what causes the scenarios. You get a big tear in the artery, and as a defense mechanism, the body forms a clot to kind of heal up, like a scab on the outside, but it obstructs blood flow. And since it's an acute event, an acute loss of blood to the heart, you collapse. You have an arrhythmia, you can die, you collapse. So that's the other form. And that's usually more in the younger generation, younger people. You don't get that more because more older people get cholesterol buildup, but it can happen at any age. The cholesterol buildup rarely happens, but in our community, we see it much younger in the 30s and 40s, premature atherosclerosis. That South Asians in their 40s have diffuse heart disease. They need bypass at a very young age. So that's something, so those are the 2 ways in general you get a heart attack. Any questions so far, or? So now the question obviously is that how do we treat it? How do we address it? The biggest thing obviously is that, when we get to see the patients, that's basically, okay, now we're treating it. But our focus more should be on preventing it. Obviously, everything is in the hands of Allah subhanahu wa ta'ala. Genetically, if you're predisposed, you get it. But how can we prevent both of those scenarios, right? So basically, the first one obviously is cholesterol buildup. So that's something, a diet, So everyone's had their cholesterol checked up. They give you different measurements: good cholesterol, bad cholesterol, total cholesterol, triglycerides. So total cholesterol is obviously a representation of all the cholesterol that's floating around. The other thing is triglycerides. So triglycerides are dependent on your diet. If your diet is very based, like a lot of people from India are vegetarians, but they have heart disease because they eat a lot of fried food. So the fried food has oil, so that builds up cholesterol, that kind of obstructs your arteries, it fills them up with cholesterol, and you get, heart disease. So obviously, triglycerides is important, so our diet is important. What I'm saying is, don't stop what you're eating, but just be careful. So having the same thing 3 times a day, fried, oily food, is not, you may not feel it right now in your 30s and 40s, but 50s and 60s, you'll have multiple blockages, and you'll be having to deal with issues. So by changing our lifestyle now, maybe once a week, kind of cutting down, or if you feel like big eaters of beef, then maybe once or twice a week. So kind of modifying instead of every single day, and then modifying what else we can add to the diet. Good cholesterol, which is HDL, you probably all of you have heard that term. They've tried many medications. Obviously this medicine world wants to push more pills onto you. So far, nothing has proven except exercise. So if you really want to increase your good cholesterol, the best way is exercise. Exercise in something that kind of conditions your heart. So you have to exercise where your heart rate goes up. Just by slow walking is very good, but brisk walking where you feel your heart racing, that's conditioning your heart. That's called cardiovascular. Treadmill, if you have bad knees, a stationary bike, that's ideal. A lot of gyms will even buy a stationary bike at home. You can do a stationary bike where you're really going fast and increasing the heart rate. So anything that increases the heart rate for a consistent period, maybe 5, 7, 10 minutes, continuously is conditioning the heart. And that raises your good cholesterol, and that makes it cardioprotective. So that kind of neutralizes any high levels of LDL or bad cholesterol. So those are some, lifestyle is key as far as really going forward at this young age. So 20, 30 years from now, you'll see the benefits of watching your cholesterol, eating healthy, and exercising. So that, again, is going to play a role in preventing it. Because like I said, our arteries are literally like, so the stents, I'll just give you a measurement. They come in 4.5 millimeters, 4 millimeters, 3 millimeters, 2.5, 2.75, 2.0 is the smallest stent. The biggest artery, it's called a widowmaker. Usually you put a 4.45 or 3.0 millimeter. Ours is like 2.5, barely 2.75, and it's all diffusely diseased. So it's just genetically we're predisposed for that. So we're already up against the wall, genetically as South Asians. But our goal obviously should be to really focus. And we've seen in our community that it's rampant. Every one of us knows immediate first relative who had stents or bypass. So it's a very common thing. So inshallah, I think the biggest step will be to start, kind of an exercise program and kind of in our home creating a healthy environment. So instead of having the traditional food that we're used to, like, floating in oil and, we can shift more towards healthy food. So what is healthy food, right? So that's the question. What's really healthy for the heart? It'll come to my second point of the second type of heart attack. So second type of heart attack, like I mentioned, was a blood clot. So the analogy I give to patients is volcanoes, right? So there's millions of volcanoes in the world. Do all of them erupt? No, right? So which volcano will erupt? Which volcanoes erupt? The one that have the hot lava, right? So how does the lava get hot? How does the lava get hot and explode? And next you know, all the communities around are swamped and they no longer have, their homes, they're all gone because the lava just got hot, exploded, the whole volcano erupted. So this analogy is the same thing with a plaque. A plaque is a small cholesterol buildup in the arteries, right? When it gets to 70, 80%, in kind of circumferential diameter, that's when it obstructs blood flow, you get symptoms. But a plaque that's 5 to 10, 20%, which is not doing anything to the blood flow, is the one that bursts, and you get a blood clot. On top of it, you get a heart attack, and then you can have a cardiac arrest. So the question becomes, what causes the plaque rupture? So in the past, people used to focus on the plaques, but they realized that heart disease actually is not a localized disease. It's a systemic disease. So it's the whole body is being inflamed. And the main concept is inflammation. Increased inflammation is what causes stroke and heart attack, which is basically rupture of the artery, blood clot forming, stopping blood flow acutely, get a stroke or a heart attack. So the million-dollar question becomes, how do we prevent a plaque from rupturing? And that's why the medications, Lipitor, Crestor, Zocor, people, when it came out, they were like, this should be in drinking water. Because it was considered an anti-inflammatory medication. It decreased the inflammation in the body, which they did through blood tests, and that decreases the risk of a stroke or heart attack by preventing plaque rupture. The cholesterol medication doesn't prevent the cholesterol from building. It'll delay the cholesterol, but the most important element that it was doing was, decreasing inflammation in the plaque, so the plaque doesn't rupture and you don't get a heart attack or stroke. That's why everyone pushes. I have cardiologists that take it prophylactically for the pleiotropic effects, that you prevent a plaque from rupturing. But outside of the medication, there are other ways, that you can help that. So I hope everyone understands this concept, right? It's a pretty simple concept that it's the plaque rupture, inflammation, the whole body. People think skin is the biggest organ of the body, but you know what the biggest organ is? The arteries, the lining of the arteries. They're equal to 6 tennis courts. From head to toe, every area needs blood. And the arteries are basically your roads and highways that carry blood. And the cholesterol builds up on those arteries. So you get people getting amputated, diabetics, because they got bad blockages in their legs. They no longer can circulate. They have to lose their legs. Heart attacks, strokes. Kidneys fail because the arteries get clogged up in the kidney of cholesterol, end up on dialysis. So this is a systemic disorder. It's not just localized to the heart. This cholesterol buildup in the artery or plaque rupture, it could happen anywhere, in the brain, in the legs. You can acute limb ischemia. Someone comes in with a plaque rupture and there's no more blood flow in the leg. They have to go emergently get a bypass of the leg or a stent in the leg. So how do we prevent it? That's the most important thing. So coming back to the concept of healthy diet, there's something called antioxidants. So at the molecular level, inflammation is countered by antioxidants, right? So antioxidants should be the focus of our diet. Foods that are high in antioxidants neutralize the plaque from rupturing. What causes the plaque to rupture is inflammation. And the most common cause of inflammation is, what do you think? What's the most common cause of inflammation in general? And it's not a disease. Stress. Stress. Most people that come in with heart attacks and strokes don't have any medical problems. And if you question them, personal, financial, other stress, right? Stress is the number one factor. Stress raises your blood pressure. So first, stress increases inflammation in the body. So now that plaque that was nice and simple sitting there, like that lava in the volcano, now gets hot. So that plaque is getting hot. It's getting ready to rupture, right? But what tips it over? So when you're stressed, what happens to your blood pressure and heart rate? They shoot up. People coming with heart attacks, you check their blood pressure, 190 over 120. Strokes, 220 over 120. This is their blood pressure when they're coming in with an acute event. Because the body is such high stress that the inflammation is just significantly elevated. So when your blood pressure is high, what's happening to the flow of blood in the arteries? So again, analogy is a lake, right? Simple lake, nice, the blood flow is what we call laminar. Nice, smooth blood flow. When your blood pressure is high, the terminology is turbulent blood flow. So, for example, when you see high waves at the shore, when people say don't go to the shore, so you can see the waves coming in and smashing up against the wall. Or we see other lakes where there's a high flow, turbulent flow, they're kind of smashing into the stone. The blood flow is like really turbulent. This is what happens to the artery. Inside the artery, the blood flow is now turbulent, right? And most of the time, the heart attack happens at a junction where the arteries branch. So it's hitting that bifurcation, and that area is already inflamed, so that when that turbulent blood flow hits that inflamed area, it bursts. And now the plaque is exposed to blood. So the blood then forms a blood clot, just like you get a scab, but our body doesn't know that it's obstructing the blood flow. So the whole artery no longer has blood, and you get an acute event, you have a cardiac arrest, or you have a stroke. So the main thing is decreasing inflammation. So definitely reducing stress is very important, right? Stress increases inflammation. So and then other diseases, diabetes, high blood pressure, they all contribute to inflammation, which basically increases inflammation and makes you more prone to these sudden events. But again, like I said, when you see the sudden events, they're usually in younger people who don't have any medical problems. And it's usually the stress that causes inflammation, acute plaque rupture, and then, have a cardiac event or a stroke. So I think that's where the focus should be is life. When they say lifestyle modification and diet modification, those are the two elements, stress reduction. Living here, we realize that, and they've shown that, especially first generation, there's a lot of stress. With the children, obviously being exposed to what's out there, when our children are going through tough times, that's the stress, financial, most of the families back home. So there's a continuous stress. So that's not good. That's not healthy. So definitely we have to work on stress reduction. Salt, right? High blood pressure, again, turbulent flow causing damage. Our diets are very, very high in iodized salt, right? So we should shift from that towards sea salt. Sea salt has less sodium. Sodium is the main culprit that causes high blood pressure. So you see a lot of people with arthritis taking a lot of Advil, Motrin, Aleve. Those are sodium-based medications. So if you have blood pressure, don't take those. It's going to raise your blood pressure. Take Tylenol. Tylenol doesn't affect, the blood pressure. So, because there's no sodium in there. So try to avoid anything that's high sodium based. Our foods, we should switch over to sea salt. It's more mineral based, less sodium, so it doesn't affect the blood pressure as much. But try to cut back on salt. Because salt itself causes high blood pressure, which is a common cause of hypertension, causing kidney disease, dialysis, and heart attack. So definitely modify our salt intake as well. The other thing that most of us, I'm guilty of it too, is lack of exercise. There has to be more exercise. That's the best way to increase cholesterol, good cholesterol, and decrease inflammation. So exercise actually decreases inflammation in the body. So the more cardiovascular exercise we engage in, the more activities we do, that's increasing our heart rate. What should a resting heart rate be? Can I ask someone, any guess? When you're sitting down right now, what should our heart rates be? So 85 is high. So the normal range is 60 to 100. If you check a resting heart rate of a basketball player while it's sitting on the bench is 45 to 50. So you've conditioned your heart to not work while you're sitting down. Why? Because so the heart fills, squeezes, right? So when it squeezes, it pushes blood to the whole body, correct? When does the heart get blood itself? When it's filling. So while the heart is filling, before it pumps the blood, it is also giving itself blood. When you're filling time, when your heart rate is fast, your filling time is low, right? And that's why you do the stress test to increase the heart rate. So if you have a blockage and you're not getting enough blood when your heart rate is fast, you're going to have signs of a heart problem. So resting heart rate is also good because it gives you enough time for filling, so the heart is also getting a lot of nourishment. So exercise lowers the heart rate. Anyone who's had heart stents, they put you on a medication called metoprolol or toprol, called a beta blocker. That's to slow the heart, to bring it to 55 to 60. But people who have a slow resting heart rate, we don't put that medication because it's going to make the heart even slower. So that's one of the important things of exercising is to get your heart rate to be a lower heart rate, that rest. So if you can get your resting heart rate to 60s, that's very good. That means now when you're sitting down, your heart rate at 60, your heart is getting enough blood, so it's happy. So you're also nourishing the heart well. So the goal of the exercise should be to increase your heart rate to get a good resting heart rate. The other thing is diet, right? So I'll talk a little bit about the diet. Antioxidants. So, we've all done some kind of, chemistry, whatever. So we know that antioxidants takes up the oxygen radicals that happen with inflammation. They cause the plaque rupture. So just like the lava, you want the lava and the volcano to be nice and cool, not being erupting. Same thing with the plaque. So antioxidants, most commonly, you see kale, blueberries, cucumbers, radishes. So these are very high antioxidants foods that we should have higher in our diet. So those antioxidants decrease inflammation. So basically, if you have a reduced stress in your life, alhamdulillah, we all have, good faith in Allah subhanahu wa ta'ala. So anything happens, we say, this is from Allah subhanahu wa ta'ala, let's deal with it instead of getting worked up, getting upset, getting our blood pressure high. We should learn how to walk away, whether it be financial loss, any type of calamity. Say, inna lillahi wa inna ilaihi raji'un, and then say, alhamdulillah, not let that stress come to you. Just kind of address the issue as is. And then change our diet so healthy lifestyle where there's more antioxidants in our food. That, inshallah, will obviously help us, live a healthier lifestyle and inshallah, prevent. That's the goal. I see majority people after the thing happened, cardiac arrest, heart attack, strokes, heart failure. So I usually see them after. Then my goal is to keep them out of the hospital. So I have to promote more prevention. So I don't, and I'm not a big pill pusher. I don't tell them. I said, they asked me, I want to come off medication. I said, change your lifestyle, lose weight, show that to me, and then you don't need the medication. Because really, medication is a lifestyle thing. So you want to eat all the bad stuff. You don't want to exercise. You don't want to lose the weight. So you pop those pills to counter everything. But if you can really live a healthy lifestyle, you may not need some of the medications. Okay? And one more question that I always get is, should I take aspirin? Right? I'm 35, I'm 40 years old. I don't want to get a heart attack or stroke. Should I be taking aspirin? In the past, there was a big push. Everyone should be on aspirin. But they've shown it doesn't prevent a heart attack or a stroke. So if you've never had one, the data is not strong enough to say you're going to prevent one. So if you've had one, then secondary prevention, yes, aspirin definitely helps. So in a nutshell, I think that's, given the fact that I explained, genetically, we're more predisposed to heart disease. Our diameter of arteries, literally, I see them and they're so small, the artery diameter. And it's just full of cholesterol. And that's generally how we are. That's how the South Asian community is. So we, like I said, have our back against the wall. So we really have to, from a young age, start, eating healthier, promoting more healthier lifestyle choices, and really working on our stress level. Alhamdulillah, it's a challenge, but those are the basic stuff that we can do to prevent. And the salt, definitely cut back on the salt intake. Those are really, things that really have bad effect on the whole body itself. And like I said, the arteries are the largest organ of the body. So you can get a cholesterol buildup anywhere from all the brain arteries to all the heart arteries, the kidneys, or your legs. And all those things lead to most common amputation, most common cause of stroke, most common cause of heart attacks. So I'll open the floor for question. I think that's better than me talking here. So.